Absolutely. I mean, everything interplays. You can't look at one without the other. So you've got body, mind, spirit. You've got to look at all three of those, and each of them will have an effect on something else. I've seen patients, for example, diabetes, that have been under significant social stressors and things like that. Their sugars start to rise without changes in medications, without changes in diet. Their sugars go up. And the treatment isn't always more meds. It's finding out what the stressors are, what we can do to help with those, and their numbers start to get better. We know that under significant stress, blood pressure can rise. That can increase your risk of heart attacks. There are natural surges in various hormone levels that occur, but stress under those periods of times can greatly increase the risk of those as well. So sometimes the solution isn't just addressing some of the physical things or adding more medicines. Sometimes it's finding out what is the actual cause, what is the problem that's leading to some of these other things. With COVID, with the isolation people, we're seeing a lot more issues with depression, anxiety, people feeling very uneasy about things, and those things need to be addressed. Unfortunately, sometimes there's still that stigma of why should I go in and talk about this? Oh, I don't want to. And medicines are necessary sometimes. Sometimes we need something because this is a biochemical process. I mean, our emotions, our feelings of depression, anxiety, it is a chemical process. And like I tell patients, if you came in and your blood pressure was high, you wouldn't just sit there and say, well, I'm going to think about this and will my blood pressure down and it's going to drop. We use medicines for it to help out. Yes, obviously diet and exercise and things help and our mental well-being, but we wouldn't think about doing that. Same thing with our cholesterol. We wouldn't go, well, I'm not going to watch my diet, I'm just going to will my cholesterol down. I'm just going to think my cholesterol is going to be lower. But when it comes to depression and anxiety, we have this idea that somehow we can make ourselves make those symptoms go away. And there's a part that we play in that. There is that part that we have to work on. But it is a chemical process. It is something that sometimes medication is needed to adjust those chemicals that aren't working right, to calm those conditions down, so some of the things that we do work on will start to work. So, getting in, talking with your provider, telling them what's going on, and looking at the best approach. Maybe what's going on is situational. Maybe it's a short-term thing. Medicines aren't necessary. Maybe it's something that, this is probably going to go on for a year or more. Maybe there is really something that we need to do on both standpoints.